Okay, hello everyone. Thanks a lot for joining today's webinar. So today we are speaking about how to become a diabetes advocate in the run-up to the UN high-level meeting on NCDs. So this webinar, some other times we have had external speakers. Today it will be just the IDF Executive Office. So I'm Beatriz Yanez, the Advocacy Coordinator. You know me through other webinars. And then we also have Shango Dimond today here.
Hello,
in
everybody.
The office. And we also have our colleague Sabine Dupont, the Advocacy Manager, joining through another location. Okay, so let's start. So the first slide, this is very important actually. So we are used to use a lot of acronyms, and sometimes people are a bit lost about what each acronym means. So these are the acronyms that we are going to use today during the webinar. So UN, United Nations, that's a quite common one, WHO for the World Health Organization. The high-level meeting, we always refer to it as HLM. Through the presentation, I will still say high-level meeting, but it will be written HLM. So NCDs, non-communicable diseases, of which diabetes is part. MS is the member states of the United Nations, or the different countries that are part of it. SDGs are the Sustainable Development Goals, so we will explain a bit more about this later. UHC, Universal Health Coverage. OD, Outcome Document, so this will be the result of the high-level meeting. And finally, CS, that's civil society, so NGOs and other organizations that are not part of a government, of a member state. Okay, so the first slide then, why is diabetes important? We believe that there are the numbers to consider it a worldwide epidemic. So last year, IDF published the 2017 Atlas, and the numbers that we estimated last year were 425 million adults with diabetes and another 352 million people with impaired glucose tolerance around the world. And we have also estimated which these numbers will be in 2045. So what we are estimating is that the number of adults with diabetes will rise to 629 million, and that the number of adults with impaired glucose tolerance will also grow up to 532 million. So actually, that's a lot of people. That's a huge proportion of the global population affected by either diabetes or impaired glucose tolerance. So we are actually speaking about a worldwide epidemic. In addition to this, we have an issue. So we have around 50% of the adults that have diabetes that are not diagnosed. This is a huge problem because, of course, these people that are not diagnosed, well, they cannot control their diabetes. And that means that they are at a higher risk of developing complications and, of course, not having a good well-being. Another very important thing is that 3/4 of the people with diabetes live in low and middle-income countries. So people have this tendency to think that diabetes affects mostly, rich societies, but actually it's not the case. 75% of people approximately are from low and middle income countries. So as we were saying before, by 2045, we estimate that 1 adult in 10 will have diabetes. So that's almost 10% of the population. And another important figure, it's the expenditure related to treat diabetes and everything around diabetes care. We estimate that 12% of global health expenditure is actually dedicated to diabetes. So that's a bit over $700 billion. So we know now these figures about diabetes. We know that it's a global epidemic, but are actually governments paying attention to it? Is diabetes in the international agenda? So this timeline shows the most important dates for diabetes over the last years, and we need to have into account that actually before 1999, diabetes and NCDs were not really on the international agenda. They did not attract a lot of political attention. So the first important date could be 1999. So this is the year in which IDF and WHO established World Diabetes Day. So as all of you know, World Diabetes Day is hosted every year on November 14. And this was a very important date because it was a way of recognizing actually the importance of diabetes and the great impact that it has around the world. In 2006, the UN passed a resolution on diabetes, the resolution 61-225. This was the result of a campaign that was led by IDF. It was a campaign called Unite for Diabetes and was heavily supported by all IDF members around the world. So this was the first UN resolution on an NCD and the second resolution on a disease. So it was very important, actually. It was really a milestone for diabetes in the past. And this resolution acknowledged that diabetes was a serious global health threat. So, of course, that meant that governments needed to start taking action. So in 2011, this could be the main date when it comes to diabetes advocacy and diabetes in the international agenda. So in this year, the UN and all the member states gathered for the first high-level meeting on NCDs. So the result of this first high-level meeting on NCDs was a UN resolution which was passed unanimously, so all the member states voted for it, and this resolution committed to keep diabetes and NCDs at the top of the international agenda. So all the important achievements that we've had over the last few years, they are due to this high-level meeting of 2011. So the first result, actually, of this high-level meeting of 2011 was the fact that WHO adopted 9 voluntary targets on NCDs. That was in the year 2013 during the World Health Assembly. So this is part of a bigger framework. So the main objective, the overarching goal, is that by 2025, the NCD-related premature mortality will be reduced in 25%. And then there are 9 voluntary targets in this framework. Four of them are very related to diabetes. So the first one is halt the rise in diabetes and obesity by 2025. Actually, diabetes is the only NCD that has its own voluntary target. The second important target for us is 80% availability of affordable and essential medicines and technologies by 2025. So, of course, diabetes is very dependent on medication, especially for people with type 1. Insulin is key. So, of course, achieving this 80% by 2025 is one of the main aims of IDF. Another of the voluntary targets is that at least 50% eligible people receive drug therapy and counseling, and that includes glycemic control to prevent heart attacks and stroke. So, of course, cardiovascular diseases, CVDs, are quite a common complication related to diabetes. So this is another very target for us. And the last one could be a 10% reduction of insufficient physical activity. So, of course, we know that physical activity is not very prominent in our societies. People tend to be more and more sedentary. So this 10% reduction is the target by 2025. So we had the first high-level meeting in 2011, and the first time that the commitments were revised was in 2014. So in 2014, the second UN high-level meeting on NCDs took place. It was the first time that the member states were assessing the progress that the countries had achieved on addressing NCDs and diabetes. And the result of this high-level meeting was an outcome document that outlined 4 time-bound commitments. So these 4 commitments were that by 2015, the member states need to consider setting national NCD targets for the year 2025. Also, by 2015, the member states needed to consider developing national multisectoral policies and plans to achieve the 2025 targets. And then we have another 2 commitments for 2016. One of them is reducing risk factors for NCDs, and the other one is considering and strengthening the health systems to address NCDs through people-centered primary healthcare and universal health coverage. So what happens after this high-level meeting is that you know that there were the Millennium Development Goals that were agreed in the year 2000. So this development agenda lasted for 15 years. And at the end of 2015, the new development agenda was approved by the UN. So that meant that the post-development agenda and the Sustainable Development Goals, the SDGs, were approved. So one thing that was lacking from the Millennium Development Goals and the previous development agenda was that NCDs and diabetes were not mentioned. So basically they were focusing more on communicable diseases, and this is something that the SDGs and the new development agenda have corrected. So we have 17 goals, and there is one goal, the goal number 3 on health. And in this goal number 3, we have 2 targets that are quite centered in NCDs and diabetes. So we have the target 3.4 on reducing NCD-related premature mortality by 30% by 2030. And then we have another target, the 3.8, on achieving universal health coverage. And these targets are to be achieved in 2030. And the last point of our timeline was 2017, so last year. So in October, WHO organized a global conference on NCDs in Uruguay, and the objective of this conference was discussing the policy actions that we need to achieve the SDG target 3.4. So it's the one that we were mentioning before of reducing 30% mortality from NCDs by 2030. So as a result of this conference, the member states that attended adopted the Montevideo Roadmap for 2018 and to 2030. And this is, a commitment from our government to really intensify action to protect people from NCDs. So, as you see, we have been speaking quite a lot about NCDs over the last 18 years, but some countries are advancing on protecting people from their effect, but in some others, the action needs to be intensified. So this was a very important conference, and it's opened the way for the third UN high-level meeting on NCDs. So this is the meeting that is happening this year. It will mean a comprehensive review of all the global and also the national progress to implement the measures to protect people from diabetes and NCDs. So as we have seen before, on the second UN high-level meeting on NCDs, the focus was on the targets that were approved by WHO, who were to be achieved by 2025. But now we are actually focusing on the targets that were agreed in the post-2015 development framework. So we are speaking more about the targets for 2030 than the targets for 2025. So this meeting, the format of it will be a one-day meeting. There will be an opening segment and then a plenary segment for general discussion. Then there will be 2 discussion panels and finally a closing segment. So why is the UN high-level meeting on NCDs important? So we have seen the timeline. The previous very important meeting on NCDs was in 2014. So this means that this is the most important meeting on NCDs that will take place over the last 4 years. And the next UN high-level meeting, so the 4th one, will very likely be in 2022. The UN is speaking about reviewing the progress every 4 years. So the UN high-level meeting on NCDs is also important because, we put an emphasis now on the need not only for global action, but also for national action. And it's also an opportunity for the member states to renew their commitments. So it's very important. All of them agreed unanimously to the commitments in 2011, but advance, it's uneven, it's quite heterogeneous. So it's important that all the member states renew the commitments that they approved before. And it's also an opportunity to bring NCDs to the attention of states, heads of state and ministries of health. So basically, for your information, in 2011, 34 heads of state attended the high-level meeting. In 2014, the situation was not that good, so there were absolutely no heads of state attending, and there were 6 ministries of health. So the situation for this year, we don't know what's going to happen. So basically, we think that it's important that the heads of state attend this meeting and that also many ministers of health attend. So of course, we need national advocacy from diabetes advocates around the world to ensure that the countries really take this high-level meeting, well, to give them the importance that it needs. The timeline, well, we see here. So basically, the UN high-level meeting is taking place on the 27th, of September. So this is quite new. We have only learned a couple of weeks ago that this was going to be the date. The meeting will take place in New York during the UN General Assembly, and at the end of the meeting, all the member states will adopt an outcome document. So before the meeting takes place, there are going to be a lot of preparations around it. So basically, there will be negotiations about this outcome document from now to July. They are led by the member state representatives in New York, but of course the national government, the capitals advise them. And then another key date for us is the UN Civil Society hearing. So this is taking place on July 5th in New York as well. And this is an opportunity for civil society to share their opinion and the priorities. And hopefully the idea is that these priorities from civil society will be included in the outcome document that the member states are negotiating. So now it's the time to speak about what IDF is actually doing around the UN high-level meeting on NCDs. So we have been working on this for around a year now. So basically, it's a very important date for us for the advocacy department, and we have prepared it for a long time. We launched a call to action that we are going to see on the next slide last October. And this call to action, the different people from the IDF network, it could be the Blue Circle Voices, the young leaders, also the IDF members, can tailor the call to action to fit it at the national level. Another thing that we are doing is promoting the request in our call to action through all the campaigns that we are having lately. So since October last year, when we launched the call to action, all the requests have been included in the different IDF activities, and we will do the same until the end of this year. So notably, for example, in the campaign for the World Diabetes Day last year, there was a component on the call to action. And finally, the third different activity that we are doing around the HLM is a social media campaign. And what we are doing is targeting, the global audience and also the global leaders and ministers of health. And the hashtag that we are using is HLM 2018. So this is the IDF call to action. So it has 4 components. The first one is increasing the focus on prevention with the objective to achieve the 0% increase in diabetes prevalence by 2025. So this is one of the WHO targets that we saw before. And we think that the way of doing this is by developing education campaigns aimed at the general population, also by implementing comprehensive lifestyle programs that are locally tailored. So this is aiming to improve the lifestyle of people, having into account the specificities of each country and region. Also, we think it's important to encourage fiscal measures and other fiscal policies and other public health measures. For example, a tax on sugary drinks or on other unhealthy products. And finally, also, when necessarily, we think that it's needed to consider the use of cost-effective medication strategies. So the second part of the call to action is focused on investment. So we want that investment is boosted so we can ensure the 80% access to essential medicines and devices by 2025 and also universal health coverage by 2030. We believe that the governments need to establish a stable budget. This is something that many governments do, many member states actually have, but some others not. And of course, a budget that is stable and it's sufficient is needed in our countries. Also, we need to improve multi-sectoral and multi-stakeholder collaboration. So that's in the light of regulating the prices of medication and enhancing the supply chain. And also, We need to leverage all existing financing sources and develop new funding mechanisms. And this is for everyone to actually have access to the essential medicine and technologies. The third component of the call to action is educating people to achieve 30% reduction in diabetes-related premature mortality by 2030. So there is a double approach to this. Of course, people with diabetes and their carers need to receive enough quality information about diabetes, but also we need healthcare professionals to receive education on diabetes, because we know that this is a very important gap, and that actually, healthcare professionals in many countries do not count on the latest information about this. The fourth component and the final one is listening to the priorities of people with diabetes and defending their rights. So in many countries, there have been many advances when it comes to this particular component, but we know that there are still many countries with people with diabetes face discrimination. So we believe it is important that governments adopt regulations to defend their rights and also have awareness campaigns so they eliminate the misconceptions that people frequently have about diabetes. And also, we believe that people with diabetes, they need to be engaged in developing the policies that the countries have to prevent and to manage diabetes. So, in order to promote our call to action, of course, we are going to have our global campaign, but we need our network to give steps nationally. So our call to action is taken into account. So the way in which you can support the IDF call to action is by requesting the support of national policymakers. So we request everyone to please contact your government to see that they engage actively in the high-level meeting, and for example, the head of your country attends the high-level meeting and renews the diabetes commitments. So the way in which you can do this is you can schedule face-to-face meetings with policymakers and present them the call to action. We understand that face-to-face meetings are not always possible, so if you cannot schedule them, we have prepared a letter, an HLM letter, that you can tailor with information from your country. We are going to give you later a link to this letter. And also, in the case of the head of government and the ministers of health, we understand that face-to-face meetings may not be possible, so please also send the letter to these people. Another way of promoting the call to action, so everyone in your country is aware of it, is promoting it through your national press. So we know that many of you may have contacts in the press, so we request you to please contact them with the call to action and offer them to have an interview around the HLM and the need to act on diabetes now. It may be the case that some of you do not have contacts on press, but you can just research a bit on identifying which are the main general and health-focused news outlets in your country, and you can just reach out to the journalists that write the health-related pieces. You can just send them the IDF call to action and again propose to offer an interview to them on it. The other component of our campaign, as we were mentioning before, is the social media campaign. The HLM 2018 is the hashtag that we are using. So we are approaching this in two ways. We are posting general messages about the need to act now. So we have an example here. IDF is calling on global leaders to fulfill their diabetes and NCD commitments. And the link is the link to the HLM webpage that we have on our website, and then we are adding, for example, the contact of the UN, the hashtag for the HLM, also hashtag right to health. And apart from these global messages, we are also having some more specific messages. So the idea is that we target key policymakers, asking them to act at the national level. So, for example, this is what we have prepared for the Prime Minister of Belgium. So his name is Charles Michel, and his username in Twitter is the same. So what we do is we start with a dot. so everyone can see the tweet, and then we add the username, and then we continue with the message. So they are both very similar messages, the general one and the specific one, but we believe that it is important to target these particular people. So we encourage you to target main policymakers from your country, and notably the head of state and the ministers of health and finance. There you have also a box with the hashtags that we are suggesting you to use in all your tweets. So of course, diabetes, do not forget it. At UN, of course, hashtag high level meeting 2018, hashtag NCDs, hashtag right to health. These are the main hashtags that you should be using in all your tweets. And then you have another set of hashtags that you can use when you have the space normally to use them. So moving on to the next slide, how can you support the IDF social media campaign? So on the one hand, you can support our global campaign. You can do this by sharing our posts with your network. You can just search for them by typing hashtag HLM 2018 on both Twitter and Facebook. And we invite you, when you share our messages, to tailor them. So you can decide to translate them in the language of your country, or also you can decide to add some figures about the diabetes epidemic in your country. That way, it will probably attract more attention of people in your country, and we believe that's very important. Finally, just to let you know, we are working on updating the HLM webpage. We are giving you the link in the last slide. So you will soon find there an advocacy calendar where we are going to add the key dates in which we will be posting messages. And we encourage you to actually also post messages on those dates, because there will be a lot of momentum on social media, and we believe it is good to actually profit it. And another way in which you can support our social media campaign is by creating your own national campaign. You can do that by posting messages with the main diabetes care gaps in your country and the main challenges that the government need to respond to. In this case, of course, you need to use your national language. That way you can reach the biggest possible audience. And as we were explaining on the previous slide, we request you to please tag policymakers from your country. So the head of government, the ministers of health and finance, of course the leader of the opposition, policymakers that you know that are involved in diabetes, etc. And as we were saying, when supporting the global campaign, you can also use the IDF advocacy calendar to post your messages around those dates. So far we have developed a few tools for the diabetes advocates. So in October last year, we launched an IDF high-level meeting toolkit. So this is available in French, in Spanish, and in English. You can find it on the IDF HLM webpage, and we will give you the link in a moment. So in this toolkit, you have a lot of information about the HLM. You have more details on the background that we have discussed previously. You also have information about how to reach national policymakers, the press, how to develop a social media campaign, and we also give you some figures that could be interesting for you in order to develop your national campaign. In this toolkit, we added a letter for government. So this is a letter that everyone can tailor with different figures from your countries. So you can see an image of the letter there. So basically it has IDF logo on it, and then we have some text that is relevant for all the countries. But then there is some text in blue that you need to tailor according to the situation in your country. So you can also access this letter separately. We will also post it on the IDF HLM webpage. And basically the idea is that you tailor this letter, and when necessarily you translate it before you send it to policymakers, and notably, as we were saying before, the head of state and the ministers of health and finance. And another of the documents that we have prepared for this campaign is the call to action document. So this is basically a one-page document in which we have included the call to action, but in a nicer way. So you can present it to policymakers during your meetings, or you can attach it when you email policymakers and the press. We are actually working now on a few more tools for our advocates. So we are working on a 2-page document about the UN high-level meeting. So basically, we understand that this toolkit that we were mentioning before is quite long. I think it's around 20 pages. And of course, it has so many information that some people do not find it very easy to use. So we have decided to create a 2-page document that is more concise and that you can use more easily to become an advocate and support our campaign around the UN high-level meeting. And as we were mentioning before, we have a web page, and we will soon post there the advocacy calendar. And in this web page, in the future, you will find all this material. So the toolkit is already there, and the 2-pager we are finalizing it this week, so it will be in the web page very soon. So after the webinar is over, we are going to send all the Blue Circle voices and all the young leaders a PDF with the slides of this webinar, and there you will be able to click on the link that we are adding next to the image of our webpage, and you will be led directly to the webpage. So this is the hyperlink, and all of you will be having it. Finally, we want to request you, if you engage with policymakers or with the press, or if you have a national social media campaign, to please keep us informed about it. You can always write to us to advocacy@idf.org to inform us of your activities, or also if you have any question around how to act around the high-level meeting. And what we ask you actually is, for example, if you contact a policymaker, please let us know if you received any feedback, if it's positive, but also if it's negative. So if you receive a response from one policymaker actually saying that they are not going to do anything around the HLM, we would like to know. For us, it's important any feedback that you can send to us. And finally, this is what we are expecting after the HLM takes place. So basically, we want all the governments to renew their diabetes and NCD commitments, and we hope that the outcome document that is approved is action-oriented. So actually, it's focused on measurable and realistic objectives to be achieved by the next HLM that we think that is going to happen in 2022. We also think that it's very important to have commitments on financing for diabetes and NCDs. We were saying before that a stable, sufficient budget is needed to address diabetes and NCDs, to have good enough care, and also to achieve essential medicines for everyone by 2030. So we need these commitments on financing, the same as we need commitments on education and a focus on reducing the risk factors. So you know that for diabetes, a healthy diet and insufficient physical activity is very important, because most of the diabetes cases are type 2 diabetes cases. So we really need to act on educational risk factors if we want to revert the diabetes tide. And finally, the main 2 targets for us to be achieved by 2030 are universal health coverage and 30% reduction in mortality by 2030. So we think that the outcome document needs to reflect what needs to be done in the next few years, so we can actually achieve these 2 objectives. Okay, so this was the presentation. We have a few people on attending the webinar online. So if any of you has a question, could you please request that we pass the floor to you, or write it in the chat? Okay, it looks like no one has any question. So as we were saying before, if you are attending this webinar later, so if you are actually having the recording, please, if you have any question, if you have any comment, just contact us at advocacy@idf.org, and we will reply to you as soon as possible. And we have one last slide, so thank you everyone for attending today. We are going to be sending this presentation to all the Blue Circle Voices and Young Leaders this afternoon, so on April 30, and the IDF members will receive it shortly. Maybe some of you are following this webinar and you are not part of one of these three groups. So if that is not the case, please contact us at advocacy@idf.org, and we will send you the slides and a link to attend the webinar recording. Okay, so thank you for attending today. And as we were saying, do not hesitate to contact us in the future if you have any questions. Thank you. Bye.